Smoke from the wildfires pollutes the air with substances that can cause severe health problems. Join us now to talk about ways to protect yourself and your loved ones is Dr. Tess Mauricio, a board-certified dermatologist from M Beauty Clinic. Dr. Tess, thank you so much for being here.
Great to be here.
You know, it means a lot to us that you are addressing the impacts these wildfires are having on our health, the skin, our respiratory system. You were just telling us that you met with the Chula Vista Fire Department to talk about skin cancer and just the impact of the air quality.
Well, first of all, we just want to be grateful to the firefighters. And last American Academy of Dermatology convention, we actually did a skin cancer check for firefighters here in San Diego. Firefighters have a higher incidence of skin cancer than your general population because they are exposed to a lot of carcinogens that contact their skin and their lungs. And so, they really are putting themselves at risk in so many ways.
Do they talk to you about what type of things that they use to protect themselves?
Well, they definitely have their shields and everything and their masks, but they're out there. And even us regular people who are not that close to the fire, we are increasing our oxidative stress. And, and not just like internal stress, but actually we are creating free radicals on our skin that can potentially then cause DNA damage, protein damage that can accelerate aging and, of course, really stress the skin.
We have been reporting on the wildfires for 2 weeks now, from Los Angeles County, now in San Diego County.
Yes.
And many are concerned about the air quality. So how can we, as San Diegans, protect ourselves, our skin, as we mentioned again, our respiratory health, our lungs?
Remember the mask? I think we have to bring it out. So we need to mask up, especially if you live close to where those fires are. But all of our air quality is affected. And so if you are close, you need to start wearing your N95 mask, especially if you have issues with your respiratory illnesses, and if you have conditions like rosacea or eczema where your skin and your face is exposed. And then, of course, you want to think about just the air quality in your home. So maybe turn on your air filters again. Things that we used to do with COVID, you got to start doing that. And then there's a lot that we can do as far as our diet, because oxidative stress is really what we're trying to combat with all of these, environmental issues. And so diet is also important.
Your thoughts on supplements on top of your diet?
Yes. So as far as diet, antioxidants is really where we want to go, right? And so with supplementation, I want people to be familiar with our most powerful antioxidant called glutathione. And glutathione is a tripeptide, and it is our master antioxidant produced by our bodies. But the great thing about it is we can consume it as a supplement tablet. We can apply it on our skin with some creams and serums, and in our clinic we actually give IV glutathione with high-dose vitamin C. So vitamin C and glutathione are really key antioxidants.
Interesting. We are all feeling the dry conditions as well with the Santa Ana winds. We feel it. Our skin is thirsty. How do you hydrate your skin, whether it's liquid that we're consuming or facials, and how to flush those impurities?
Absolutely. So drinking plenty of water, because we need to flush out the toxins, but there are incredible moisturizers out there that are richer. Look for ingredients like ceramides, hyaluronic acid in your moisturizer and serum. And you really need to wash your skin. That seems to be basic, but you also want to use cream cleanser so that it doesn't strip the skin of your natural moisture. And then having a humidifier in your home to bring back that moisture really can help.
I never thought about these things during these dry conditions and the fire-prone weather. Another thing I want to talk to you about is, what about those who have underlying conditions as far as respiratory failure or interstitial lung disease, when you have that scarring in the lung, which is kind of hard to breathe when you're in fire-prone areas or bad air quality?
Absolutely. So those who've been affected with COVID may have what you're talking about. And so if you are prone to that, you really need to go out with your N95 mask and try to minimize being outside, and do not do aerobic exercises outside right now, because you are requiring your lungs to work and you will inhale a lot of that pollutants and, potentially carcinogenic things if you're close to a fire area.
during this last week with these fires burning in San Diego County, what are you seeing at MBD Clinic as far as your clients coming in concerned about their health and skin?
Yes. Well, today actually we treated a patient with severe eczema, and things are the normal things that she would use. They're not responding to that, and so if you have issues with itching, burning, skin is irritated, you really need to go in and see your dermatologist because we can help. We can really relieve your suffering as soon as possible.
All right, Dr. Tess, thank you so much for being here and helping us out during this fire season. We appreciate it.
And thank you to the firefighters.
Yeah, thank you.